This is Dr. Lewis, and this video is specifically for patients who have been scheduled for either a spinal cord stimulator trial or a spinal cord stimulator implant. For a spinal cord stimulator trial, we're attempting to treat a certain area of chronic pain, whether it be chronic leg pain, back pain, neck pain, or arm pain, by treating the actual spinal cord and the specific pain fibers within the spinal cord that are on their way to the brain to be registered, of course, as pain within the brain. This procedure is only appropriate for patients where the actual source for the pain cannot be identified or can't be treated. An example would be a traumatic amputation of a lower extremity, where someone has lost a leg below the knee but continues to have the perception of severe pain in a foot that no longer exists. So of course there's no treatment that can be provided for that foot, but we can treat the central nervous system with a therapy that may provide significant relief. Other types of pain that might be treated are failed back surgery syndrome or complex regional pain syndromes from either injury or other types of trauma. Our goal in this procedure is to place a very small catheter within the epidural space. So imagine you have a bony tube that is your spinal column, and within that bony tube you actually have the spinal cord. Our job is to place a small catheter inside the bony column but outside of the actual spinal cord. It's actually exactly the same space that a woman has a catheter placed when she's going to have a labor epidural, so the procedure is very routine. On the trial day, we'll bring you to the office, an IV will be placed. We'll give you a small amount of antibiotic, mostly because the catheter and the trial is going to be in place for the next 4 to 5 days. But once we have you back in the procedure room with some light sedation, you'll be awake and talking to me. We'll clean off your back and numb the skin, and we'll place 2 needles into the epidural space into exactly the same position that you would have if you were simply having a lumbar epidural steroid injection. So this is a very routine access to the epidural space. But on this trip, once we've identified that space, a very small catheter will be advanced into that space and onto the back side of the spinal cord where all of the pain fibers are. Now, you will not feel those pain fibers stimulated at this point in time because they're inside the actual leathery bag that surrounds the spinal cord. So we're inside the bony tube, outside that bag. With fluoroscopic guidance, that we can then advance those catheters, which have little titanium electrodes, and in our trial phases those are usually 16 electrodes per catheters, and we usually put in 2 catheters, so you have 32 small titanium electrodes sitting inside the spinal canal. And we will advance, under fluoroscopic guidance, we'll advance those leads right to a certain area, typically in the thoracic spine. So we'll enter the spine low, we'll advance it into the thoracic spine, and then we'll place those little leads into the space outside of the spinal cord, but inside the actual spinal canal. Once we have those leads in the place where we identified as being most likely to treat your pain, we're attempting to stimulate the actual dorsal column, which is where all the pain fibers travel on their way to the brain. We want to stimulate this at a very high frequency but very low voltage, to the point that those pain fibers pick up our signal and preferentially send that signal to the brain, which your brain will register either as nothing or as a type of buzzing and tingly feeling, as if your lower extremity or the extremity that we're attempting to treat had been placed into a jacuzzi. Our goal is to fool the central nervous system into feeling a stimulation that overwhelms the painful stimulation to the point where you no longer feel the painful stimulation. The beauty of this trial is, unlike any other surgery on the spine, we get to take the results for a test drive before anything more invasive is pursued. So in our practice, whether we're treating neck pain, arm pain, low back, or leg pain, we'll place those leads into the epidural space at the area of the spine that we think is going to be most advantageous. But we'll test you as you're in the room. While the leads are in place, we'll turn them on, and we'll be able to verify that you're feeling the stimulation in the extremity that we wish to treat. At that point in time, we'll anchor those leads in place with a bandage, and you'll be taken back to recovery area. We then have a representative that will then tune your system specifically for your specific trial, whether that's to treat only right foot pain, or just left knee pain, or low back pain, or neck pain, or arm pain. We want to provide you with a number of settings so that when you go home, because you will go home, and for the next 4 days, you'll have a small controller and you'll be able to actually decide when the system's on, what channel it's on. When you're on a channel, what volume it's on. You can raise it up, you can lower it down. You may have a channel that you like when you're sleeping, a channel you like when you're walking, a channel that you like when you're on the treadmill. On each one of those channels, you can choose the channel and then you can choose the volume, or you can decide to turn it off. But of course, we'll encourage you to have it on as much as possible because you have a short number of days to take this system for a trial run. At the end of the trial, you'll come back into the office, we'll remove the bandage, and the leads will literally, they can be pulled out. You'll have no sensation with that component at all. It's like I say, it's the same invasiveness that a woman has when she has a labor epidural. So at the end of the trial, we'll then discuss with you whether or not you felt that this was successful enough to consider moving forward with a permanent implant. My experience in my practice has generally been approximately 85% of patients who have been selected for this type of testing elect to move forward with permanent implantation. But there is a 15% chance that it simply doesn't provide you with enough pain control to move forward. But the good thing is that we haven't done any surgery, and unlike any other surgery, we can decide not to move forward at that point in time. But if you are fortunate enough that this treats your pain to a very significant degree, then we can provide you with a permanent implant that can be performed at our Colorado Canyons Hospital Medical Center surgical site. And at that point in time, under light sedation, while you're awake and talking to me, we'll simply numb the skin. We'll place the leads into exactly the same place that they were during your trial, and we'll test it again while you're able to talk to us. Once we're able to confirm that we have the leads where they were successfully treating before, we'll now pass the leads under the skin, under surgical conditions, and make a small little surgical incision to place a small battery, which is really no larger than the size of a small Oreo cookie. This is the brains and the battery for the system, and we can have multiple settings. As I mentioned before, you may have a setting that you like when you're sleeping, a setting that you like when you're walking, a setting you like with different types of activities. We've had people who are very active, people who are ice climbers, people who are competitive snowboarders, people who are Formula One race car drivers. So our goal is not to provide you with a system where you have to be careful. Our goal is to provide you with a system that allows you to get back to having your life again. So once that battery has been placed under the skin, we'll close the two incision sites. Now, everything is under the skin just like somebody who has a pacemaker, but you'll have a controller that allows you to turn it on. You can change the channels, you can raise the volume, and if you come into the office, we can place a small antenna against your pulse generator site, access the brains within the system, and modify a previous channel, add a new channel. But at during the entire process, you have complete control over which channel you're on and what volume you're on. This can be very successful at treating pain that is untreatable with more surgery, medications, medication management, and of course, it's a narcotic-free option for treating pain. This is something we've done many hundreds of times in Western Colorado, and we have many patients that had felt that there were no further options available to them. And after we had exhausted all other non-surgical options, this very minor surgery allowed them to have a system that has provided them with years of pain control. So if you have a chronic pain problem that is untreated, don't assume that nothing can be done simply because you've failed to have success up to this point in time. Come talk to us at our office and see if we can find an answer for you. Thank you.